Some people are not well skilled to negotiate for even protection during intercourse. And also in our culture, it's a man thing to discuss sex, when they want, when it should be done, and all that. So looking at all that, it has predisposed our people to continue having very high numbers of HIV infection, and especially among young people.
Okay.
Yeah.
Thanks for that, and even just highlighting what are some of the reasons as to why we are actually witnessing unsafe sexual behavior. Dr. Vickie, we also may not be understanding the health implications when some of these diseases that we could consider as minor are left untreated. So, for example, what really would happen if I continue to ignore these symptoms that I am actually witnessing? The discharge, the lower abdomen pain, the painful urination, if you will. What could someone be potentially facing if they were to leave this untreated?
Okay, so I will break it down to, say, 3 consequences or prognosis of leaving sexually transmitted infections untreated. So the first thing, especially for ladies, we have something called pelvic inflammatory disease. Yes, so this is a chronic condition that happens when you leave, especially chlamydia and gonorrhea, untreated. So you find a lady who has chronic pelvic pain throughout, has been there for years. They'll tell you that they've experienced this pain for years. Sometimes they don't even know that they have this pain. They've ignored it for so long that it's become part of them.
Yeah, they're just like,
So this chronic pelvic pain could be pelvic inflammatory disease, and then the consequence is infertility at the end of the day. Yes, the tubes, what I was talking about infertility last time, and we talked about the tubal factors, which is the tubes getting blocked. So these infections have left scar tissue that is over time, continuing scarring and then rendering those tubes non-patent. So you get infertility through the tubal factors. You'll get pelvic inflammatory disease, which again is going to cause infertility. And we have that chronic pelvic pain. For a disease like syphilis has a number of stages that it goes through. We have the primary stage, we have the secondary stage, we have a latent phase, and then we have a tertiary phase. Now, you can imagine if you leave it untreated from the primary phase, which is a chancre, which is more or less like a lesion in your penis or your vagina or your vulva, sorry. So this lesion, you leave it untreated, goes ahead, becomes now secondary infection that is now systemic. It spreads throughout the whole body.
Correct.
So now you have patches in your hair, you have alopecia, you have a rash all over your body, and you have those lesions in your palms and soles.
Right.
Yeah, that's secondary disease. And then you go now to a latent phase where it will disappear. And then you'll say, now I'm healed, But it is still there. Some people
it's manifesting.
No, it is latent. It is just quiet. But you still have it. Like herpes, the way we say herpes is lifetime, it's lifelong, sorry, and then you don't see the manifestation at that stage.
It's just dormant.
It's dormant, that's the word I was looking for, yes, dormant. So it's that latent phase. Now the lesions go away, the rash goes away, the fever and the malaise goes away. Now it's just, you remain an agent. You can spread the disease, but you're not manifesting it. And then now it comes now to the tertiary phase now, which is very, very fatal, because it will be now cardiovascular manifestations and neurosyphilis, which is the brain and the spinal cord.
Right, which is why we've seen, I think, I was just talking to Movie about this. I didn't even know that, people who have like tertiary levels of syphilis are almost at the level of psychosis. They just start having, all sorts of illusions. I mean, they're completely losing
and everything. Yes, they lose it.
Mm-hmm.
And that time, maybe you got now to the hospital, and doctors are looking for all these, brain tumors, I don't know, meningitis, thinking it's bacterial meningitis, because it will mimic meningitis for sure. That stiff neck, that confusion, So at this point now, it's syphilis now. By the time they diagnose syphilis, it's like an exclusion, diagnosis of exclusion at this point. So it is syphilis that maybe even got you when you are teen or early 20s, and you manifest at 60 or 70 with neurosyphilis.
That is scary to think about.
Very scary.
Well, we do want to share our question of the day with you, dear viewer, but as you do know, we're talking about STI prevention, this being in line with STI in Condom Week that's being marked, or rather has been marked from 7th to the 14th of February. Yes, indeed. What more do we need to know about practicing safe sex and preventing transmission? Quite the conversation that we need to have, especially when you're looking at this demographic, the youth in particular. So we're asking, what methods do you think should be administered to help promote safer sex practices, especially amongst young adults? What methods do you think should be administered to help promote safer sex practices, especially amongst young adults? That's our question of the day, courtesy of the team at K24 TV is how you can reach us. We'll be sampling your text messages in just a few on WhatsApp. But that being said, you know, you did say this, Jade, and you mentioned some of the factors that are contributing to unsafe sexual behavior. But there's something I want us to expound on, because now we've already covered that. In fact, you've already answered what I had put down for you. But there's that issue that you talked about, women not being able to protect themselves for a number of these factors that are there. And so it almost sounds to me that there needs to be a lot of female empowerment around safe sex. So what needs to be done? Because if they're the more vulnerable ones in comparison to their male counterparts, what happens? Because like you said, the conversation ideally lies with the man. What needs to be happening so that I can have more knowledge, I can be able to negotiate better in terms of, you know, condom use? What needs to happen?
Thank you, Shiko. And one of the things we need to do as a country is availing the information, because information is power. And organizations, for example, Alva City Health, through a website called One-to-One, we are able, because youths do not want to come and find Daktari and I seated there asking them, what is happening to you? Let me see, let me see what kind of a discharge. Yeah. They are so afraid. Right. They first want to face it virtually. And then from virtual, now they know I can refer you to a certain doctor who is very friendly, who will give you human-centered services and all that. So one of the things we need to is to provide the information.
Correct.
And then from there, to empower youth and young people with negotiation skills.
Yes.
That is what needs to be done. But even before I go, allow me just to highlight something that is happening to our country. That in this country, we still do not have enough data about STIs. We do not have data.
It's a very gray area.
It's a very gray area. And I was privileged to represent our organization when we are developing the policy, the STI policy. And one of the things we noted is that there was not enough data, but at least we have what we call the prevalences among different subpopulations. And the STI prevalence in Kenya among the key population, when you talk about the key population, is what Dr. was talking about: men who have sex with men, female sex workers, people who inject drugs, and then we have general population. For key population is about 9%. So meaning for every 100 key population people, we have about 9 of them will have a certain STI, as Dr. said. And then from there, if we break it down to look to specific subpopulation, is the highest number, and Dr. touched about the anal sex, where we got the MSM leading at the prevalence, meaning for every 100, 26 of them have an STI that is not diagnosed, that is not treated. That is quite huge.
It is.
When we look at the female sex workers, it's at 13%. That is still huge. The 13 women are having an STI out of 100. So multiply that with our population and tell me how many STIs do we have in the country.
By the way, we do. Because, and I think even King of Condom explained that very well last time he was here, because if one sex worker has about maybe 10 clients in a week on average, how many people are out there with STIs not knowing that they have one?
Tell me. And then when we come to people who inject drug, we have about 4 of them. Because of the drug, most of them are not very sexually active. Let's go to general population. You see the people who may think, no, I don't have risk, I'm not at risk. It's at 2%. So meaning for every 100, about 2 of them are having an STI, and that STI is not treated, is not diagnosed. So what we need to do is availing information. What is my risk? as a young woman, what is my risk? I need to know what is my risk, and I know these are the ways that I can prevent myself from my STIs. In case I have one, Dr. has just discussed what are some of the things you're going to notice. For example, working in a clinic, I used to ask women, what is the normal discharge that comes out of your private parts? You'll hear people say yellow, green, pink, white.
No way.
Yes.
What?
Because that's what they have been experiencing.
Right.
They do not have information. So it's very important for us to avail channels where we can get information. It's also very important for us as a country to ensure we do research. Research ensures that we make the right decisions. We know the exact number of people who are having a certain disease and how can we prevent, how can we manage and control.
So Jane, what you're essentially saying is that we need to move this conversation beyond providing condoms.
Thank you. That is
it can't just be, oh, use a condom, but what other information needs to be available to people out there? So we need to start preaching about it. We're going to take a short commercial break. I think Brenda has told me that we're at that point. Okay, in 2 minutes or so. But let's remind our viewers of the question of the day, Brenda, if you will. Thank you very much. As I fix this, what methods do you think should be administered to help promote safer sex practices, especially amongst young adults? Okay, so as we take that break in just a few, Dr. let me engage you briefly on the issue of symptoms, because even when you just read up on some of these STIs, some of them apparently don't really, become that apparent. So how would I know if at all I don't have those symptoms? Are you simply saying that people just need to get into the habit of getting tested, or
yes, what? Regular screening, that's for sure, and especially what you talked about, the key population. These are female sex workers, men having sex with men, pregnant ladies, and people living with HIV, because again HIV will give you, will make you susceptible to getting other sexually transmitted infections. So what we need to do now, especially the key population group, is to regularly screen ourselves, because most of the people are going to be asymptomatic and they're going to be carriers, just spreading the disease and not getting treated themselves. So first of all, regular screening, and secondly, there's this habit of when somebody comes and gets diagnosed, with an STI, do they treat the partners? Do we do contact tracing, for all the people that you've had sexual contact with or intimate with? So all this, one partner will get treated and then we don't treat we don't need the sexual partner. You have multiple partners, you don't get to tell them that you are treated for an STI. They go around thinking they're fine and probably they are symptomatic. Again, there are diseases like syphilis, which will have an incubation period. You get say 10 to 90 days is what you said, 10 to 90 days incubation period. So you can imagine a 3-week period before you know that you are actually infected. So basically is screening. The screening is the only solution. And whenever you can, use barrier method of protection from is the only method of protection that is going to be effective against STIs. Barrier methods.
And here's the thing. You can get it when you talk to a lady who's part of the Kenya Sex Workers Alliance. There's strength in numbers and they can get that resource. Now, there's someone who's out there, Jane, who is sexually active and wondering, what do I need to keep getting screened for? I think you need to highlight, for those of us who are not classified as key population groups, what's your message to us, in regards to what Dr. Vickie is talking about?
Thank you, Shiko. And one of the things we are very proud of is that our government has already highlighted, if you're a key population, when do you need to be screened? If you're a general population, and you see sometimes is the general population, because you say you're a general population, but you have multiple partners.
Wow. So exactly, for those of you who have multiple partners, munajijua.
So you go multiple partners. So one of the things I say, know your risk.
Yes.
You go multiple partners, be able to negotiate. Ensure that you're aware, where can I get these commodities? And I was having a very interesting discussion with young people where I asked them, where do you want us to place these commodities? Akina, condoms and things like those ones. Some of them were coming up with very interesting things. For example, they don't want to go at the CCC, at the hospitals where everybody can see them and they're with their parents. So what they said, they want them to be placed in places like Kinyozi.
Oh, wow.
In a salon. A social place. A social place. But it must be hidden. Not everywhere where Jane is seeing, I am picking a CD, where are you going? You see? So it's very important for us to ensure that we involve the people in whatever we do.
Okay, public participation.
Yes.
A very interesting point, or at least something worth noting. That needs to happen if we're going to get the solutions that we require. We do want to take that short commercial break, like I had mentioned earlier on, dear viewer, but we're asking you to talk to us if you haven't already. Our question of the day still stands. What methods do you think should be administered to help promote safer sex practices, especially amongst young adults? Remember today, Dr. Vickie and Jane are stressing the issue of screening on a regular basis. And of course, it also takes public participation, like Jane had actually said. What's your take on today's discussion as we talk about STI prevention? There's more to come right here on Health and Wellness. Stick with us.
Now on the Health and Wellness segment,